A warm welcome to all our viewers, to our series Natural Medicine. People come to me again and again, or are connected via Zoom, or there are comments on YouTube, where it says, "My doctor found nothing about me, my illness was psychological." Well, I don't know if there might not still be a cause somewhere that needs to be found. That's why it's important for me to do a show about it. Is it really always psychological, and can you really not find anything? That's the theme of the show. Be sure to stay tuned. And here we are again. And I would like to discuss this important topic with the chief physician of the Sonnenberg Clinic today, who came especially for that. Dear Alexandra Kotthaus, a warm welcome. And thank you for taking the time.
Thank you, Alexander.
It's a little bit your area. You told me that from your psychic training, you brought psychosomatics into medicine, into academic medicine. And you certainly know this phrase, it's psychological, don't you?
Exactly.
And knowing you, you certainly didn't want to settle for that.
Exactly. Yes, that's right. Well, I only started my career by doing internal medicine. But then I thought, 6 years in academic medicine, in internal medicine, I don't think I want to do that. Then I went into psychiatry. And after I became a psychiatrist, I became a general practitioner. So like the psychiatrist says, went back into the somatic. And let me tell you, I do everything now except surgery. And it's like that. Yes, sometimes it's like that. Now I know both sides. And that is often the case when the somatic doctor, so somatic means nothing other than physical, the physical doctor, who treats the physical diseases, as opposed to the psychiatrist. If they don't get any further, then they often make the diagnosis, that's psychosomatic. Sometimes there is also the nice word functional gastrointestinal complaints, for example.
I've also heard imagination.
But that's when they're a little less nice, the doctor, or maybe very annoyed. Exactly. Yes, then people are sent to a psychiatrist. The psychiatrist then usually has the feeling, oh, this one, the somatic doctor has already examined the patient well, then it might be psychiatric or psychosomatic. And then I think to myself, with my experience in psychiatry, it must be clear to me somehow that certain symptoms cannot be explained psychologically, psychosomatically, because there is actually a different scheme behind it. But this wishy-washy, what kind of clinical picture is it, or this overlapping? I think that's becoming more and more common, just like it is now with the long COVID syndrome, which is at least recognized in a certain way by academic medicine, but now that I have read a newspaper article in the last few days, that the insurers doubt that it is physical, so to speak, and put it back on this psychological track. But it's often just the case that if the somatic doctor doesn't get any further, then it's just psychosomatic. And the patient usually feels exactly, no, there is something wrong with my body. And I've also simply learned to recognize this sentence when the patient says, I'm not myself, and not as, no, that's part of the mental disorder now, to say, I'm not myself, but to take that really seriously. There can, or even very, very often is, maybe even almost always, or at least sometimes something physical behind it.
So the wording, I'm not myself, I've heard that a lot from doctors about hormone fluctuations. So generally hormone status within the body or bacterial via the intestine, that the gut ultimately influences the brain.
Yes, exactly. Although I almost think that we are almost at the symptom level. So 95% of the serotonin is in the gut and not in the brain. And I don't think most psychiatrists know that.
No?
No. And serotonin also controls our intestinal motility, for example.
That is the happiness hormone.
Exactly. It is commonly referred to as the happiness hormone. And it has a few more functions in the body. It also has receptors on the blood platelets, for example, that respond to serotonin. It's actually just a small part that really sits in the brain. And then we still have, what did you just say? So gut and hormones. If the hormones are mixed up, I think we are already in the symptom area. Of course, this can also have an effect on the psyche. But why are the hormones messed up? It's not just because a woman is going through menopause. But there are other reasons. There can simply also be, we say, xenoestrogens behind it. Xeno is the Greek word for alien, non-human female hormones. So there we have a whole range of environmental toxins. A well-known one is glyphosate. But also, if you ever notice that BPA-free is written on plastic bottles, beverage bottles. This is a plasticizer that also has an estrogen effect. And there's still a lot of that. Then we have pyrethroids and PFOA. This can also be found in the waterproofing of sportswear, coating of frying pans, plastic packaging. Generally from food, plastic, drink bottles, new cars. You can smell that weird chemical smell. The sources are very diverse. Various pesticides, not just glyphosate, are included. Even mercury can function as a hormone disruptor.
I always have the pleasure and honor of making shows with Professor Christian Schubert, psychoneuroimmunologist from Innsbruck. And he tells me he's done so many scientific studies which document that the psyche has an influence on the body. Regarding the health. And now the patients have health, physical problems. And they are just told, it's psychological. Okay, maybe it is. But something has to be done about the cause. Are these people really being taken care of? Or are they left to their own devices?
Well, usually not. With the diagnosis you're psycho, go see a psychiatrist. The psychiatrist is doing their best. It depends. Now we have to differentiate between psychiatrists and psychologists. There are also medical psychotherapists and psychological psychotherapists. That means one studied medicine and the other studied psychology. And whether you then do psychotherapy, that is, whether you go to someone who does psychotherapy, or whether you go to a psychiatrist who does not do psychotherapy, where they usually learned it, but often just don't practice it, but then delegate it further and say, let's try various medications. A lot of patients don't like that.
It's nice that the psychologist can write prescriptions.
Yes, but not the psychologist, but the psychiatrist.
The psychiatrist can do it, fine.
And I've always met patients, but not where I work now. Now in our Sonnenberg Biomedicine Clinic, I no longer work in the classic psychiatric way, but earlier, when I was still working as a psychiatrist, where people then wanted to go to a normal psychiatrist and not to a biodoctor, there were always some who said, well, I definitely want to continue taking the Zyprolex, because then I won't get so upset about my wife.
That's an antidepressant.
It's an antidepressant, but it also leads to a so-called emotional shift in some people. That means they are a bit, not necessarily happy and content, but just a bit indifferent. To put it bluntly, they don't give a damn when the wife is in a nagging mood or something, because she might be having hormone fluctuations, or something, or is also poisoned. And then, as a rule, one antidepressant is tried after the other. And usually with more or less success, but also not infrequently with less success. Although one must also say that even if we now look at the study situation on antidepressants, it is actually only really justified in severe depression. So that's when it is indicated to prescribe it. And the effect that if someone gets better now, only 25% is actually coming from these antidepressants.
I still have to write it down. Those were just some good phrases. But the fact is that these antidepressants are $1 billion market and there are actually people who are totally dependent on them, right?
Yes, definitely. Sometimes it's not that easy to stop taking it. When I started in psychiatry, it was still said that these things are not addictive. When I stopped there, people said, well, formally it is also a physical dependency. These drugs are definitely changing the receptor density on the cell surface, on the synapses. That means that you usually can't just discontinue like that, but that you have to reckon with a rebound, so with an aggravation.
But the fact is, you are treated with antidepressants, but there is no cause-related treatment.
It is not even said that they are doing better. And that's not treating the cause, exactly.
And now what do we do with the people? They live with it now, they say they have a mental problem and are given antidepressants. Was that it now?
In academic medicine, yes. Psychotherapy is usually offered as well. And then it slowly stops there with what is on the market. Or the official possibilities.
But that wasn't your way.
No, that wasn't my way.
You wanted to bring people out of it.
I wasn't satisfied with that. And I have also seen that many patients are not satisfied with it at all. A few are happy when things get better. But when they are doing better and are stable, then many say, when can I discontinue this? This usually doesn't go well, or doesn't go well for long. Or maybe 1, 2, 3 years. And then comes the next depression. And then the next drug comes again. Or if it helped back then, try the same thing again. Then we still have some side effects, such as weight gain, and sometimes a loss of libido, or erectile dysfunction in men. So what you're taking is not candy. And yeah, I didn't like that. And I've always wondered, there must be more. And of course, I'm very happy that I found this way. And on the one hand it's like that. Someone who is acutely unwell, there are definitely substances which can be given adequately, which may not always be free of side effects, but are very low in side effects. So if I, also in a natural way, raise the serotonin level, it can cause a few side effects. But usually not to the extent and severity, and certainly not for the liver, as classic antidepressants are causing now. But even that would still be a symptom treatment, which is sometimes necessary. And the treatment of the cause is usually what you have already indicated. Of course, we talk a lot about nutrition and the gut. There are also very clear studies that say, simply through a sensible change in diet I have at least the same effectiveness as with antidepressants. Mind you, compared to classic or, better said, the most effective antidepressants, without having the side effects, and simply having a more lasting effect, even if you let the diet slip again. The same applies to sports, for depression, equally effective. From 3 times a week, 20 minutes, endurance sports, I can achieve the same effect as with an antidepressant.
Oh yes, that would actually be great medicine, wouldn't it? When you see these people who are really down right now.
Yes, although one has to say, is it realistic for people, depending on how deep they are down, which can have very, very different characteristics. There is a definition, so to speak, of what major depression is, but the severity of depression can be even deeper than just meeting the diagnostic criteria. You just have to look at where you pick up the patient, what is just realistic for them to implement at the moment. Sometimes, even as a doctor, you have to dig deep and really do it step by step. And then it's easier to take a few supplements than to say now, and then maybe as soon as possible, maybe we'll start with a walk, and then maybe go jogging afterwards.
But isn't it also dangerous for you doctors, ultimately if you don't start with the antidepressants right away? Because if a patient is in depression and maybe does something to themselves or someone else, or something, and then you have the connection to the doctor who said, do a bit of sport 3 times a week, instead of prescribing antidepressants. Considering that we are in an age when one always blames someone else, it makes you enforceable.
Many patients who come to me at this stage have already tried antidepressants before and said, I can't stand them, I had these symptoms, those symptoms, I don't know, I do not want that. then I can say, the therapy attempt is already over. And the other thing is, in my opinion, or now me specifically, as a psychiatrist, I don't lean out the window more or less than before. Of course, I've learned to clarify the suicidality, or how to ask about it. Sometimes other doctors shy away, general practitioners a bit more. They are a bit faster there or just unsure, because they might not know how to graduate, or get a commitment from the patient. But the other thing is, not everyone who is depressed is suicidal.
Is there just this diagnosis now, it's psychological, or is it there always a cause to look for somewhere on the body behind this obvious description, psychologically conditioned?
I always say that the body and the soul are like that. They are very closely linked. And the effect goes both ways. But someone who is depressed usually also has measurable physical disorders. Sometimes it's easier. I treat the body first and then see what's left of the mental problem. Psychotherapy works much easier and much better for someone who is simply physically better again. If these people still need psychotherapy at all. I have also seen young people. There are young people who have a certain type of poisoning and thereby a certain constellation of nutrient deficit, because then certain nutrients are simply needed more for detoxification. There I had, even when I was still working as a family doctor, a young man around 16 years, shortly before finishing school, symptoms of dizziness, tantrums. Didn't go to school, refused school. I also read a long letter from the psychiatric colleague. A borderline disorder was diagnosed and I thought, I wasn't the psychiatrist at the moment. I was the family doctor. But I also saw the physical symptoms, which again were only pushed to psychosomatic. He really didn't have much money. I couldn't do much therapy with him, which had to be paid for. I simply prescribed him a vitamin B complex, and after that he went back to school. He graduated from school. He started an apprenticeship, all of which was completely called into question. Now, of course, you have to honestly say I have a few cases from time to time that are so easy to treat, but of course it's not always that easy, but that's something typical for young people. Or young girls who become weird or get mentally noticeable symptoms of fatigue. One has to ask, do they take the pill? But then it is not the hormone, but with some, the pill causes a severe vitamin B6 deficiency. And the vitamin B6 also has a lot of influence on hormone balance. And that is something that is often overlooked.
And you only react when the symptoms are very high, instead of giving B6 somehow beforehand.
Theoretically, a conventional medical gynecologist should know about the B6 and the pill. It's not such a big secret.
Really? So every gynecologist who is listening right now should actually say, okay, prescribe the pill, prescribe B6 as well.
You have to at least determine it or keep an eye on it. So someone who gets symptoms on the pill, there are many women, young girls, who get various, let me say, aches and pains, are actually more tired than before, have bleeding between periods. You should have that in mind. Or, for example, a porphyria is a rare disease, but also a disease known to conventional medicine, which is simply extremely common among psychiatric patients. But where I experience again and again that many psychiatrists do not know this, do not know that it can lead to neurological disorders. So in conventional medicine there is no treatment idea, unless it is an acute attack. Then you give glucose infusion with paracetamol, which actually relieves the symptoms, because certain metabolic products are broken down more quickly, but it is not a cause therapy. Or what you are simply not aware of, what the consequences are, that phosphorines have something to do with hemoglobin, that it has something to do with the detoxification system, that is the red blood pigment, hemoglobin, that occurs in the cytochrome, which in turn is an enzyme that occurs in the liver in the detoxification metabolism, occurs in the respiratory chain of the mitochondria, so are cell power plants, for oxygen combustion, and ATP recovery and such. It's not so rare that when someone has real psychological symptoms, up to and including schizophrenia, you should actually think of something like that, but these are real illnesses, but they in turn have a physical counterpart. And then there are those who are sometimes just annoying for the doctor, because they don't find what they have and the patient is suffering, and maybe it also sometimes is a woman who expresses her feelings more vehemently than a man does, who is perhaps a little more quiet and grumpy. And a woman who might be a bit more expressive then, or is miserable, or maybe even cries, because she's just had enough and can no longer take it, and something must be there in my body, and she is not taken seriously. And then they give Temesta to calm down and come down. Or earlier there was always the restorative injection.
What was in there?
Well, thank God, that's gone down a bit. It was sort of like, basically, one of the earlier forms of antidepressants. The woman was fine then. And I'm assuming now that the mostly male doctor had his piece. And you repeat the injections, and then it went well for a while. However, the injection had the problem that the so-called tardive dyskinesia can occur. Dyskinesias are involuntary movements. It looks like that. If someone has something like that, then it's possible that they were injected with this drug 30 years earlier, when it was just modern. There are also side effects associated with certain antidepressants or neuroleptics that can appear after decades and cannot be treated with conventional medicine.
In summary, can one say that if a viewer now says that they actually want to get off these antidepressants, that there is always some way in cooperation with a competent doctor who accompanies them on this way?
Basically, I would say yes. There are always cases, but you just have to be aware if someone is already taking antidepressants or taking mood stabilizers, which are not easily discontinued. You really have to do the preparatory work first, also do detoxification work, treat the intestines, and then you just have to taper them because, as I said, the receptors on the cell surface change so that this slowly regresses. Otherwise, it doesn't work well.
I know of a case where a doctor explained it to me, and that was in connection with a court judgment in Germany in connection with a homicide. The perpetrator was then acquitted. He was not of sound mind because his intestinal environment was so bad that it was possible to connect and prove the gut-brain axis, that there was such a strong change in his personality that he wasn't himself at all. And then I said to myself, my God, that's really intense. And the verdict is also interesting because one has definitely recognized these connections from the gut to the brain. And I have to say that we are all well advised to take care of the intestines.
Definitely. For me, nobody gets around the topic of nutrition. No patient. That is enormously important, and you can do a great deal with it. That's out of the question. The most impressive cases are always the quickest. It's often children. In my opinion, these are the most impressive cases. I had several children with what is known as Lennox-Gastaut epilepsy. This is a form of epilepsy that is rather difficult to treat. They had often already gone through all conventional anti-epileptic drugs. Still seizures. One boy had seizures every day, smaller to larger, a little twitching in the arm up to a really generalized seizure. And after a month of changing his diet, he was only having 2 seizures a month instead of 1+ a day. So the gut and brain correlation is so close.
You know, you say that no patient can get through without nutritional advice. But it's a shame and bad enough. The patients only come to you when they are really ill and actually want to get well again out of necessity and look for a way. They are lucky to find you. But most others have no idea. They're in this cascade with malnutrition. Intestinal environment changes. Then there is a change of character and so on. And finally, at some point, enough is enough. They get the psychiatric drugs. They are calmed down that they can live with the new change of character. It's actually kind of sick. Actually, we should explain that in school. I just miss it so much that we would learn again at school, in school lessons. My God, we're learning so much crap. Facebook recently said, there was a study. In a university course over X years, 90% is forgotten in the first year after graduation. 90. What do you learn those 90% for if you forget them a year later?
Well, I always said to my children, to train the brain. Learning itself also creates new brain synapses.
You find something positive, very good.
But surely, the system could be improved.
Or learn things that also train the brain, but would be important for a lifetime, such as to really do the nutritional advice in such a way that it is stable. Thanks very much. I think we were able to communicate clearly, mentally ill or everything is mental or ultimately no diagnosis found. It's psychological. Or they imagine it, etc. You should not be satisfied with that, but still look for a doctor who really can connect these components between the psycho and the somatic. In the so-called psychosomatics. And just suitable people, doctors, specialists, they can do that and free you from such medications. Did I summarize that correctly?
Yes.
Good. Do you have one last word for the viewers? Baffled.
Baffled.
I think we'll leave it at that. Thank you very much for this interview. That was for you, dear viewers, the Chief Physician Alexandra Kotthaus. And I hope you take this home with you, this topic. And if you know someone faced with such antidepressant drugs, maybe just pass this show on to them. Hoping that perhaps another way of looking at these things can be presented and the person can then free themselves from such medications and begin a holistic path. In this sense, all the best, and see you next time.